Kalimera. That will probably be luckily, or maybe unfortunately, depending on your point of view, the only Greek words that you hear from me today, because at this point my vocabulary is a little limited, so I will be delivering this presentation in English. Language limitations aside, I am really excited to have the opportunity to talk to you about a topic that I'm really passionate about, and that is pharmaceutical investment in the pharmaceutical sector as a driver for economic growth. I feel that way because it's important not only for the pharmaceutical industry, but also for the health of Greece and the economy more broadly. And as we start to think about the future direction of the country, as has already been alluded to, I think it takes on even more importance when we start to look beyond the difficult measures that we have to enact as part of the bailout and start to think about how do we return this economy back to a trajectory of sustainable growth. And it is the premise of my discussion today that the pharmaceutical industry, whether it be multinational or local, offers one such opportunity to do that and should be considered as a valuable and necessary ingredient in any long-term growth plan that we develop for this country. And I make those statements not just out of theory, but also from the confidence drawn from real examples here in Europe of countries of either similar size to Greece or that have gone through similar economic difficulties in the recent past. So I want to pose a question today and begin to start to answer it. And that is, if other countries can do it, why not Greece? Why not Greece? And so specifically, I'll talk about three things. Number one, I'm going to talk a little bit about the value of investing in pharmaceuticals. Number two, I'm going to characterize the level of investment already here in Greece and the return that we get on that investment. And then lastly, I'm going to spend some time talking about how we can maintain that investment and expand on it potentially in the future. All right, let's begin the discussion by talking about the strong correlation between our investment in healthcare and in pharmaceuticals and our improvement in health and the importance of continuing to invest in innovation. At our core, our business is about improving health. And by many metrics, we do a good job of that. This is an important one. This is taken from Lichtenberg. Many of you may have seen this data before, but it's still a relevant message. And the bottom line is that we extend lives, right? That's what this industry is about. It's the most rigorous measure we can have, and we do it. This is data over a recent 15-year period where we extended the length of life by 1 year, but that's after a 30-year improvement over the prior 100 years. All right, so significant progress has been made here. We don't just extend life, we improve the quality of that life. So as an example, if you look at rheumatoid arthritis, we've been able to decrease the disability associated with that condition through a series of innovations over the last decade. So I think it's pretty fair to conclude that a lot of progress has been made by this important metric. But it's also equally fair to say that this game is not over. The job is not done. There's still significant medical need, whether we look at areas like cancer or Alzheimer's disease or the wave of people that will be coming through the population, right? The aging population that was referenced earlier, there's still a need. And there are promising innovations and research processes that are on the horizon that offer the promise for those solutions, for those cures. Now, pharmaceuticals across Europe are a key driver of economic opportunity. They are a priority within the high-tech sector. Why is that? It's because of the link between health whether it be driven by pharmaceuticals, improvements in education or lifestyle, and wealth, through things like improvement in productivity, a larger and stronger workforce, and the output that it produces, right? It is a virtual cycle, a positive virtual cycle between health and wealth. And as we explore that connection between health and wealth a little more closely, I think one of the most obvious contributions that as an industry we make to the economy is through employment. So if you look at employment in Greece, which is what you see on the left-hand side of this slide, we contribute about 130,000 jobs to the economy, both direct and indirect jobs. And as was referenced earlier, many of these are high-skilled jobs, right? So we are helping to prevent a brain drain, which many have speculated about and we've already started to see. And that would be a shame, right? That would be a shame for this country. And not only is the impact significant in terms of the number of people, but also the economic contribution. So if we were to dollarize this, this is worth about $7.5 billion, or about 4.5% of GDP. Now, while employment is one of the most obvious benefits that the industry brings to the economy, it is by no means the only one. As was referenced in the last conversation, R&D is a real opportunity. In fact, if you look across Europe, pharmaceuticals are the most intensive R&D industry that we have. We spend the most amount of our revenue back into R&D. Similarly, manufacturing is a great opportunity, and we have large footprints in several countries across Europe, and I'm going to come back to that point. But just remember those variables, because we will explore them a little bit further. So it's employment, R&D, and manufacturing. And I hope that gives you a sense, at least at a high level, for the economic contribution that the industry makes to Greece and other economies across Europe. I now want to move on and explore the second area, and that is, well, all right, so let's talk about Greece and the level of contribution that we make here. This is just one example. It happens to be the example that I know best. It is Pfizer-Hellas, but I think it's representative of what we see from across the industry, the types of investments, the scale of the investments that the pharmaceutical industry is making into this country. So in our case, we employ about 350 people, either directly as employees or as contractors. And it's also worth noting that we work with about 6,000 vendors. So we provide meaningful work and revenue to those companies and their employees as well. We contribute over 100 million euros to the economy through things like wages, taxes, and rebates, and a variety of other mechanisms. We're involved in research and development to the tune of about 70 studies of varying shapes and forms, and we produce about 15% of our volume locally here in Greece. So as I mentioned, it's one company, but magnify that by 100, and you start to get a sense for the level of investment, the magnitude of it, and the breadth and scope of that investment. And what I'd like you to take away is that there is a significant footprint in this company, whether it be local companies or multinational companies. It is large. Now, maybe the harder question is, how are we treating that investment? What sorts of returns are we receiving on it? And sort of the punchline, the headline here is, honestly, not very well. Right? We're not getting a good enough return on that investment. It's not inspiring more investment, at least not easily. So why is that? Well, first of all, as investors, we're putting money into a shrinking market. You see that on the left-hand side of this slide. This is looking at public spend over the last 5-6 years, in which we've seen that market shrink to being less than half of what it was when we started. Secondly, the sales that we are generating in this shrinking market, we are getting, at best, deferred payments on those sales. We have arrears reaching what are becoming really intolerable levels, $1.3 billion across the industry. I'll say that number again because it's pretty large, $1.3 billion, yet the industry continues to be here, right? And the payment terms are certainly much longer than what the law would suggest. We're out past 9 months at this point. And we're putting money into a country that has the lowest list prices in Europe, and then we discount those prices further through things like rebates and clawbacks, all of which leads to a pretty significant tax of over $500 million just for doing business here in the country. All right, so candidly, these are not the ideal circumstances for investment. It doesn't inspire further investment. It's harder to make that pitch, right, to your company or within your company, depending on where you sit. The final question I'd like to explore is, well, does that have to be the outcome? Is that really the path that we need or want to go down, or is there a better path? And I want to come back to the question I posed before, why not Greece? All right, so as I alluded to in my opening comments, there are 2 European countries that I'll hold out as examples that are either a similar size to Greece, Belgium, or that have experienced difficult economic times recently, Ireland, that have gone down different paths, that have made different choices about this industry and how they see it fitting into their long-term growth plan. So these are just first the facts, looking at 3 key variables that I introduced earlier. Employment. Even though we have a pretty significant footprint of employment here in Greece, and now we're just looking at the direct numbers. Remember, each direct employee leads to 5 to 6 indirect employments. But these are just the direct numbers. Compare ourselves to Belgium or Ireland, right? They're almost 3 or 2 times greater than the level of employment that we have. One of those reasons is, in the case of Belgium, is they've invested significantly in R&D. There are about $30 billion invested in Europe in R&D, and they've positioned themselves well to capture a nice share of that investment. They're just behind countries like the UK, and I mean, a whisker behind the big 5 across Europe, and about 30 times the level of investment that we're able to get in Greece now. And then, as was referenced by the prior speaker earlier, manufacturing. It's a great opportunity, right, to manufacture products in this country. And while we do some of it, you can see that other countries are able to do more. They're able to produce more, even though their circumstances and size are similar to ours. So what is it going to take? Why are they able to do it, and why haven't we been able to do it? That's there's probably a very complex answer to that. But I'm going to put forward at least some basic tenets for us to think about. So what you see here, just to explain the slide, is on the vertical axis are a series of variables, and on the horizontal axis, sort of a qualitative assessment of where we sit on those. So it starts first with your human capital and your infrastructure, right? You need high-skilled people in place. And we have that advantage here in Greece. If you look at the population aged 25 to 35, about 40% of those people have secondary degrees. That's about double what we see across Europe as an average. And even though our clinical trials trail behind some other countries, we certainly punch well above our weight in terms of our national stature, of our physicians, of our researchers. They lead major associations across Europe. They are internationally renowned. So we have the human capital. We have some of the academic centers and research centers required to do this. Countries like Belgium and Ireland had to invest significant dollars to get to that point. And while we would probably have to make some investment, we're going to start from what I would argue is a good baseline. We also need to look at our foundation. And in particular, we need a investment climate, we'll say, that is more predictable and more pro-business, to be very candid about it. If you look at Ireland or Belgium, they are similar in the sense that they have predictable payment, okay, and they have tax systems that are clear, simple, favorable, right? They give tax benefits for greater investments in those countries. And let's contrast that to our situation, right? The payment's not clear, how much we're going to get, when it's going to come. We've made something like 140 changes to our tax laws over the last 5 years in this country. So think about trying to administer that as a business. Any given month, you have no idea what your tax liability is going to be. There was a research study done here across industries, and companies were asked, what would be, the most important factor to increasing investment in Greece? 90% of the people said, we need to clarify the tax system. We need to simplify it, and we need to make it fairer. If we get that foundation right, then I think we can elevate to the types of private and public partnerships that were discussed earlier. In places like Belgium and Ireland, what they did is they talked about how they could make the pharmaceutical sector a key component to the future growth of that company, and they banded together to do that. They made collective investments to create the right climate, to get the dollars for R&D, to get the facilities and the resources for manufacturing. And in turn, they then rewarded the outputs of those efforts, right? So products that were coming out of their research centers, that were coming out of their manufacturing, they made sure that they had room in their healthcare system to afford them. So just to finish up, I'm going to come back to the question I posed in the beginning, why not? And why not Greece? Why can't we follow the path to growth like Ireland and Belgium? And I'd like to propose to you that despite the difficult circumstances that we face right now, and they are difficult, that this is still within our grasp. If we look beyond our immediate issues and challenges and look to the future and start to work together to collectively solve these challenges, then I would argue that it could be Greece and that it is within our grasp. Thank you very much for your time.
Thank you, Jim. You can join us. Περίμενα 30 χρόνια να προεδρεύσω σε ένα τραπέζι που θα μιλάει ο καθηγητής μου, ο κ. Φαντόπουλος. Δεν θα μπω στον πειρασμό να κοιτάξω το ρολόι μου όπως κάνει συνήθως όταν μιλάω εγώ, γιατί είμαι σίγουρος ότι θα είναι όπως πάντα απολαυστικός.